Thank you so much for joining the Sasfin team as well as obviously the Discovery Health team. We will be taking you through the Discovery Health presentation today, whereby we'll be showing you what the changes are for 2023 and how you as a member will be affected. And also, if you are going to be changing your option, what you need to do, what the necessary steps are. We'll also be giving you tips and so on in the presentation. People, this is a webinar, so if there are any questions, please feel free to use the chat box. Post your question as soon as it pops up so that obviously you remember that question. It would obviously benefit everyone that's on the webinar. And like I said, I'm Mohammed from Sasfin Healthcare, and we'll be going through obviously the Discovery Health presentation and the changes for 2023. Our agenda today, from a compliance perspective, who Sasfin is, what we do as your Sasfin Healthcare consultants. We take you through the Discovery Health benefit updates, touch a bit on vitality, and then we also speak about the Sasfin Gap product, and obviously if you are going to be implementing any changes, what you need to do going forward. So very important that Sasfin Healthcare is a division of Sasfin Financial Advisory Services. We are a registered FSP as well as registered with the Council of Medical Schemes. And very important is that our disclosures are available to any one of our clients. So if you feel that you haven't been treated fairly or you need more information, or you want to log a complaint against a specific consultant, our disclosures has all of that information. So if you do need a disclosure, please feel free to ask any one of our Sasfin Healthcare or your Sasfin Healthcare consultant. We will be providing contact details at the end of the session as well. Okay, so why Sasfin Healthcare Consulting and what do we assist with as your consultant? So we basically assist in helping and assisting them in choosing the correct option, and also understanding your benefits. So very important is a lot of members are on a specific medical aid. They're not fully aware as to how the benefits work. Am I on the correct plan? It's just not a simple matter of obviously your premiums suiting your family's needs. It could be that obviously you might require less needs than what you're obviously currently paying for. And this is why you have a Sasfin Healthcare consultant to obviously assist and obviously help you understand your benefits much better. We then also assist with resolution of escalated queries. So in the event that there is a specific issue that you're not winning with the scheme, you then come to us. We are allowed to represent you on behalf of the medical scheme. So we'll assist you with obviously adding dependents, adding a chronic condition. If a claim wasn't processed correctly, we will assist you with obviously having that claim processed correctly. We provide your HR with the latest industry development updates, market analysis, and HR payroll and support, whereby we then take all the schemes in the country. It's very important to note that we are independent consultant firm, whereby we don't only do discovery, but this presentation here is specifically for the Discovery Health members. We do all the open schemes in the open scheme market. So just to give you the top few schemes in the market that we obviously assist and help with, would be Discovery Health, Bonitas, BestMed, Seasway, FedHealth, Momentum, MedScheme, and so on, and so the list goes on. We then also provide various other health recommendations. So for example, we also help you with your gap cover, your vitality benefits. There are certain low-cost income options that we could also assist with. All of that is also assisted by your Sasfin Healthcare consultant. Okay. So in terms of the Discovery Health Medical Scheme, we have our Discovery Health Corporate Health Manager, Karenisa Ramsamy. She is the Corporate Health Manager that will be taking us through the changes. So like I said, if there are any questions, please feel free to put that in the chat box. And Karenisa, thank you for joining, and over to you.
Good morning, everybody. As Mohammed said, I'm the Corporate Health Manager together with Sasfin, and I'll be taking you through the 2023 benefit enhancements as well as the contribution strategy. To start off, Discovery Health's core purpose is to make people healthier and enhance and protect their lives. And this is fundamental to everything that we do, as we always want to make sure we stay true to this core purpose when we are thinking about the following year's benefits. Discovery Health, just to give you a little bit of background and in terms of our financial position within the industry, Discovery Health Medical Scheme has maintained a strong reserve position even while we were addressing the short-term affordability through the contribution deferral strategies that we've taken over the COVID-19 periods. You see that even through these years, we were still able to maintain a 36% solvency ratio in terms of what the council requires us to have in our reserves as a scheme. team, we are way above that amount, where we are sitting with 8.3 billion Rand in our reserves. What that means for you as a member is that we are able to financially support our members when it comes to claims should there be a pandemic arise, like we have seen with COVID-19. We've also managed to maintain a AAA global rating score, where it shows that we within the industry itself. In the last 2 years, we have taken a deferral contribution strategy when it comes to our increases, where we've delayed the premiums by certain number of months. So going into 2023, we want to do the exact same process, and simply because this assisted our members in their affordability. So what you will see happen in 2023 is you will not have an increase effective from the 1st of Jan 2023. Your increase will only be effective from the 1st of April 2023. The benefit enhancements that I am going to speak to will be increasing effective from the 1st of Jan. So what that means for you as a member is you will be able to enjoy the 2023 enhancements for the first 3 months at the 2022 contribution rates. Speaking to the benefit enhancements, the first enhancement that you will see is under our oncology benefit. And if you are familiar with how the oncology benefit works currently, you would know that all our plans except for the key care plan have a Rand value, which we refer to as an oncology threshold. From the 1st of Jan next year, this threshold is going to be increased by 25%. So on the executive and comprehensive plan, you will now have an oncology threshold of 500,000 Rand. On the classic smart comprehensive, you will have a threshold of 375,000 Rand. And on the saver priority smart and core plans, you'll have a threshold of 250,000 Rand. Under our high cost chronic medicines, under the specialized medicine and technology benefit, as well as our chronic formulary drug amounts and the formulary list, you will see these, or you will see certain changes being applied to these benefits. If you are registered on our chronic illness benefit program, we have started communicating with our members already. So communication will continue with our affected members. So if you've received communication, please take note of it and ensure that you understand the communication from the chronic team. If you haven't received communication, then there will be no changes that's applicable to your benefit. Under our plans, we have something called an international second opinion service, and this benefit will be increasing next year. So what this benefit is, it gives our members access to receiving a second opinion from doctors or specialists within the Cleveland Clinic for any life-threatening or life-changing conditions. This benefit is currently covered at 50% of the cost of the consultation. From next year onwards, we will now cover this at 75% on our plans. There will be changes to limits, co-payments, deductibles, as well as the annual thresholds. So your annual thresholds will be increased by 9.9%. Your co-payments and deductibles will be increased by 6%. And your benefit limits will be increased on the 1st of Jan 2023. So very important to note of that. There will be some changes that will remain unchanged, or some benefits rather that will remain unchanged. I'm going to speak to 2 programs that we are going to be introducing for next year. And the first one is a disease prevention program. What this program is, it is going to be an artificial intelligence driven program where we will be able to take a member's health check results, their family history, claims pattern, as well as demographics into consideration. And then we will identify our high risk members who are at high risk for developing cardiometabolic syndrome diseases or diabetes itself. Once these members have been identified, a health coach will be allocated to them, and then that health coach will then reach out to the member. Once the program is explained to the member, if the member does consent to joining the program, the member will be enrolled onto a 12-month program. The 12 months will consist of a risk-funded basket of care, which will include 2 GP consultations, 12 coaching sessions, as well as 2 nutritional assessments and prescribed medication. At the end of the 12 months, there's 3 outcomes that can occur. The first one is member will be flagged as a green status. And if the member is flagged as a green status, that means they were able to use the learnings from the program and they were able to maintain their level of risk and nothing, or they haven't been developed into any conditions. Should a member be diagnosed or flagged under a yellow or amber status, that means the member was not able to manage their level of risk, and they will require ongoing medication to maintain their level of risk because they now have been diagnosed with impaired glucose tolerance or impaired glucose fasting. If the member is flagged as a red status, it means that they were not able to maintain their level of risk at all and they have now been diagnosed with diabetes. Should that occur, member will then be enrolled onto the chronic illness benefit program where they will receive their monthly medication as well as access to a prescribed minimum benefit basket of care, and they can receive additional benefits through the diabetes care program. The second program that you will be seeing introduced is the Wealth Fund, and I want to emphasize a little bit on this program, and the reason for that is this program is a discretionary program that is going to be available to our members from the 1st of Jan 2023 only for 24 months. So you will only have this benefit available to you for the next 24 months. After the 24 months, this benefit will be non-existent. The reason this benefit has been created and the reason why it is a discretionary benefit is because of the excess amount of funds that we have in our medical reserves or medical scheme reserves. We were trying to give back to our members by allowing and creating this benefit. Reason for this benefit being created is prior to COVID-19, we have had benefits in place where our members could access screening and prevention benefit testings. And by members doing those testings, they were able to then get diagnosed or find out about serious conditions at a much earlier stage as compared to a later stage. But obviously, when COVID-19 hit, a lot of us wanted to stay away from medical facilities unless we really needed to go through to them just because we didn't want to be exposed to COVID-19. So what that meant is that members stopped doing screening and preventative testing, and we found that because they have stopped doing that, they are now being diagnosed. So we've seen a higher number of members being diagnosed with the more advanced stages of illnesses as compared to a early stage of illness. So we want to encourage our members to start doing these screening and preventative testings again, hence the creation of this benefit for 2 years. How it will work is you will have to unlock the benefit by doing a health check. The health check consists of your blood pressure, your blood glucose, your BMI testing, your cholesterol levels, as well as a voluntary HIV testing, which can be done at a Clicks Discount or your company's wellness day if it's applicable to your your company. Adult members will receive 2,500 Rand. Any child dependent over the age of 2 will receive 1,250 Rand, and a family of 4 will receive a capped amount of 10,000 Rand for the benefit. What you will be able to access using this benefit is the following tests on the next slide, which is anything under your physical health, your general health. You'll also receive medical monitoring devices, tests under mental health, women's health, men's health, as well as children's health, which all will not affect your medical savings account, and it will be funded from the risk benefit. Sticking to the new introductions for 2023, you will see a change under the Smart series, and there's 2 changes that will be applicable. The first one that I'm going to speak to is regarding the new plan that we are going to be creating, and the second one will be the new hospital network that ties in with this new plan. So if we look at the Smart series, we know it's a very digital-based plan, and currently there is only 2 options that you can choose from, which is the Classic Smart Plan or the Essential Smart Plan. From the 1st of Jan next year, you will have an additional option, which is called the Essential Dynamic Smart Plan for you to choose from between your plans. It is underpinned by the Smart series, so some of the benefits will be exactly the same as per you receive currently. And together with this plan, you will have a new hospital network that goes with it. So this hospital network is called the Essential Dynamic Smart Hospital Network, or the Dynamic Smart Hospital Network. What it does do is it takes the member's geolocation into consideration. It takes their diagnosis and health record, as well as the provider data that we have available to us. And once the member says that they do need to go into hospital for a planned procedure, it will take all that information into consideration and then direct the member to the closest hospital, which will give them the highest quality of care. Provided that hospital is part of the Dynamic Smart Hospital, the member will be able to go through and have the treatment done at that facility. Of course, this does apply to planned procedures. When it comes to our network options, we do advise our members, should there be a medical emergency, they should be going to the nearest hospital. On our Discovery Health Medical Scheme, you have 25 different plans to choose from, depending on your medical or your financial needs. I'm going to go through the plans that you see on system and explain in detail what each one covers. So if we look at our lower range or benefit option, you have the key care plans where you have 4 different plans that you can choose from. Important to note from the key care plans is that it is an income-based plan. So depending on your income, that will determine your monthly premium that you pay. And then the other important point is that it is a network-based option. So your doctors that you use, as well as your facilities and hospitals that you make use of, have to be on the key care network in order for you to receive full cover from this plan. It does not have a medical savings account. On the Key Care Plus and the Key Care Start, there are certain day-to-day benefit covers that is available, which is funded from the risk benefit. Then you have our hospital benefit option, which is the core series. Under the core series, you have 5 different plans that you can choose from. If the plan says Delta, then that means it is a network option, and you will have to use a hospital that's under the Delta network for planned procedures. Other than that, if it does not say Delta, you will be able to use any private hospital that you wish to use. And what's important to note is on the core series, because it is a hospital benefit option, it does not have any day-to-day cover. So anything done out of hospital will be paid for from your own pocket. Then we move on to our medium benefit options, and that we start off with the Smart Series. So this is where you start getting a little bit more in your day-to-day cover. So on the Smart Series, it is a very digital-based plan. It is a network-based plan. So irrespective of whether you go on a classic or essential smart plan, you do have to abide to the smart network of hospitals for those planned procedures. There are certain day-to-day procedures and consultations that are covered, but again, it has to be doctors that fall within the smart network. Under your Saver series, this is where your benefits start increasing in terms of your day-to-day funding. So under the Saver series, you have 5 different plans that you can choose from. Again, if it says Delta, that will mean that it's a network option. So those planned procedures will have to be done at Delta facilities. If it doesn't say Delta, you can go to any facility. What's important to note here for your day-to-day cover is now you have access to a medical savings account, which is a portion that you pay from your premium that's allocated to you at the beginning of every year. That is used for all your day-to-day benefits, and once that is finished, then only you start funding for claims again from your own pocket. On your Priority series, which is the one higher than the Saver series, it works exactly the same way as the Saver series in terms of your hospitalization and your day-to-day cover. However, here you do not have the option for a network option. So whether you choose the classic plan or whether you choose the essential plan, you'll be able to visit any private hospital. And the additional benefit on the Priority series is that once your medical savings account has been depleted, you will now have access to something called a limited above threshold benefit, where there is a portion called the self-payment gap that you will have to close. Once that is being closed, you will then be able to access the limited above threshold benefit, which is Discovery Health Medical Scheme, allowing you more funding to pay for your day-to-day healthcare needs. Under our comprehensive benefit options, we have two plans or two series for you to choose from, which is the executive plan, which is the highest option, and then we have the comprehensive series. Under the comprehensive series, you have 5 different plans that you can choose from again. There is some network hospitals or network plans available under the comprehensive series, which will say Delta or Smart if you are interested in those network options. The nice thing or the interesting thing about the comprehensive and the executive plans is that your above threshold benefit now becomes unlimited once you have closed that self-payment gap on the comprehensive and the executive plans. What's also additional benefits on this is that you do receive additional chronic benefits, which I will discuss later on in the presentation. Just to give you an overview of where we stand in terms of our plans and what we can cover for with regards to an overview of our members and claims that we've received in the last 12 months, you see that Discovery Health Medical Scheme is able to fund for our members' claimings. If we take, for example, members that have gone through for heart surgeries between the ages of 49, we actually funded for around 4 million Rand worth of claims for our members. So again, speaking to the sustainability of the scheme, that we will be able to cater for our members' claims as and when needed. I'm going to be taking you through the product platform that is available on all our Discovery Health Medical Scheme plans. Where it is not applicable to a certain plan, I will mention that separately. The first one that I'm going to speak to is the core benefits. And if you look at our plans, you'll see on the next slide that all our plans have access to an unlimited hospital cover. What this means is that none of our plans have an limit to our hospital benefit, whether you are on the highest plan or the lowest plan. There is no overall limit to our hospital cover for those planned procedures. You also have full access to cover for emergencies. This is at any private hospital for life-threatening medical emergencies. When it comes to your cover for in-hospital specialists, we have arrangements or payment arrangements with majority of specialists across the country. And how we differentiate the cover between these specialists is, if you refer to the plan series that that was displayed on the screen previously, you'll see that between our series, we have either a choice between classic plans or essential plans. What that means is all our classic plans will cover you at 200% in hospital when you or at the Discovery Health rate when you are admitted. The essential plans will cover you at 100% of the Discovery Health rate. And what that means in plain English is that should a Discovery Health rate be 1,000 Rand for a procedure, but the specialist you are using is charging you 2,000 Rand for that procedure, if you are on a classic plan, Discovery Health will cover the full 2,000 Rand for you. If you are on an essential plan, we will then only cover you at 100%, which is the 1,000 Rand, and you will have a 1,000 Rand shortfall. All our plans have access to private hospitals, except for if you are on a network option, which I did emphasize previously. So the network options will be any option that says Delta, Smart, Key or Coastal. And of course, the Coastal will only be applicable to people residing in the coastal regions. And you'll see that within our hospital networks, on the next slide, we actually managed to grow our networks where we do have quite a number of hospitals and day clinics on these network options. So you shouldn't feel that should you be going on a network option, you're not going to have facilities to choose from. If you look at our Delta network, we have 53 hospitals currently on it and 121 day clinics. Under our Smart network, we have 60 hospitals currently, and our Kike network has 122 hospitals under our network. All our plans have access to something called a chronic illness benefit. And what this allows our members to get access to is that monthly medication should you be diagnosed with a chronic condition. So all our plans cover you for 27 different conditions. And this is reflected under the white column on the screen currently. Every single one of our plans cover you for those conditions. Thank you. On the comprehensive, sorry, you can just go back to the chronic screen, Mohammed. On the comprehensive and the executive plans, there is additional conditions that are covered, which is what I spoke to, where you have additional chronic benefits earlier on. And this is listed under the black column on the page that you are currently viewing. So how the chronic benefit works is that we will cover the monthly medication, as well as you'll receive access to a prescribed minimum basket of care to cover you for a defined list of treatments. If your medication is on a formulary list, we will be covering the medication in full. However, if it is not part of formulary list, we will cover it up to a chronic drug amount, and there will be a co-payment that you will be able to fund from your own pocket. How you will be able to access your chronic medication, you will see on the next slide that we have a huge amount of pharmacies within our pharmacy network, and you'll have different options for you to receive your medication. Where you will be able to order them through our online or member app under our medicine tracker functionality. You can either order your medication online and get it delivered directly to you. You can order your medication online and then go and collect it at a pharmacy if you prefer to do so, or you can go directly to the pharmacy and collect your medication and get your refill. Under the medicine tracker app functionality, you also have the option to setting up reminders, which will prompt you as to when you to take your medication as prescribed. Our plans also have access to a screening and prevention benefit, and this is available to all our plans again. You have access to screening for kids, which will include height, weight, head circumference testing, as well as health and milestone tracking. You also have access to a screening and prevention benefit for our adults, which is the first one is the health check that I spoke to, which will be funded from the risk benefit. And the additional screening test that you have available is mammograms every 2 years, pap smears every 3 years, prostate-specific antigen tests every year. And you also have members that are aged between 45 and 75 have access to bowel cancer screening tests every 2 years. Now, very important that these tests are paid from the risk benefit. It does not affect your medical savings account. And remember, if you are flagged as a low-risk member, then these frequency limits do apply to you. However, if you are flagged as a high-risk member and have notified us of that, then you will have access to these tests on a yearly basis. Lastly, under the screening benefit, we have screening for our senior members, which are aged 65 years and older, and they have access to certain fall risk assessment screening tests that will be available to them. Our plans have a maternity benefit, and this covers you during your pregnancy, after you give birth, as well as pre and postnatal care. During your pregnancy, members have access to 8 consultations with either a GP, gynecologist, or midwife. You have 2 scans that will be covered, and if you meet the clinical entry criteria, there's also an NIPT test that will be covered. Members have access to a flu vaccine, as well as a defined list of blood tests that are covered under the maternity benefit. After you give birth, your baby does have cover for 2 years under the maternity benefit, where they will have 2 visits to a GP, pediatrician, or an ENT specialist. And some of the other healthcare services that you receive as a mum is you do have postnatal consultations, should there have been a complication at the time of delivery. You also have access to nutritional assessments with a dietitian and 2 mental health care consultations with either a counselor or a psychologist. Under your pre and postnatal care, you have access to 5 antenatal or postnatal consultations, and it also allows you access to 1 breastfeeding consultation. I'm going to speak to how the day-to-day cover benefit works. And if you recall, when we were doing the plan summary, this is available to our members from the Saver series upwards, and it's called your medical savings account. So important things to remember around the medical savings account is that it is abbreviated as MSA. You do not lose your MSA at any point. So if come the end of 2022, you still have 5,000 Rand in your medical savings account, that amount will be carried over into 2023 2023, and you will get the new 2023 additional amounts that need to be added to you. You will not lose your medical savings account at any point, as it will continuously be carried over should you not make use of it. These funds are used for your day-to-day healthcare needs, so your dentistry, your optometry, any x-rays or blood tests done out of hospital, as well as GP visits and medicines that are not chronic or not approved under the chronic benefit. Certain plans, which is from the priority series up to the executive series, do have access to an above threshold benefit, which we have gone through, and that will cover you for additional benefits under your day-to-day healthcare needs once your medical savings account has been depleted. Because you have access to a medical savings account, you have an additional benefit available to you on our plans that have an MSA, which is called the day-to-day extender benefit. What this benefit consists of, it gives our members access to nurse consultations in our pharmacy network through the telemedicine platform. You also have video call consultations through our connected care platform, as well as you are covered for GP consultations should you be referred for one. Kids that are under the age of 10 do have access to 2 casualty visits, which will also be funded from the day-to-day extender benefit. I'm going to talk to a few of the programs or conservative and chronic care programs that we have available for our members. The first one is our mental health care program, and this will provide our members access to cover for the management of major depression, and it includes prescribed medication, individual or group psychotherapy sessions, as well as additional GP consultations. And qualifying members also have access to the relapse prevention program once you are registered for the mental health program. We have our diabetes care program, and this is for our members who are already registered on the chronic illness benefit for diabetes. Should their Premier Plus GP enroll them under this program, they will receive additional glucometer strips, consultations with dietitians and biokinetics, and they will also have nurse educators to assist them in their day-to-day management of their condition. Under our cardio care program, this is available to all our members that are registered on the chronic illness benefit for hypertension, which is high blood pressure, hyperlipidemia, which is cholesterol, or ischemic heart disease. And should their Premier Plus GP enroll them on this program, they will have a defined basket of care, as well as annual cardiovascular assessments if referred by their Premier Plus GP. And then under the HIV care program, this is for our members that are registered for HIV. They will have access to clinical care, cover for social workers, as well as prescribed medication. And what's very nice about this is through our member app, you are able to track your health once you have been registered for these programs itself. The last 2 programs that I want to speak to is our conservative care programs. And this is providing our members access with cover for out-of-hospital conservative care and treatment to help them manage their conditions. We have 2 programs under this conservative care, where the first one is a program for dyspepsia, and this is severe heartburn. What this program provides our member with is cover for a defined basket of care for the out-of-hospital management and treatment of dyspepsia. It will also provide them with additional out-of-hospital benefits, which is paid from the hospital benefit. They will receive additional testings and medicines. And once they've completed the program, if they still need to be referred for a gastroscopy, we will cover the gastroscopy up to 100% of the Discovery Health rate with no co-payment or deductible applicable. The last program is our spinal care program, and this is for conservative spinal treatment for out-of-hospital management on treatment of this condition, where members will receive or receive a defined basket of care cover. They will also have virtual and face-to-face consultations with a appropriately registered healthcare professional. Under our executive and comprehensive plans, we do have a benefit that is applicable to only these 2 plans, and it is called the ART benefit, Assisted Reproductive Therapy benefit. We have recently created this benefit, and what it allows members access to is 2 cycles of ART, provided the member meets the clinical entry criteria. They are able to access any SASREC accredited center, and what the benefit will be enhanced to next year is that it will now include treatment related to cytopreservation, embryo freezing, as well as egg donated cycles on the plan. Speaking to the extra benefits that you will see available on your plan, you have the international travel benefit that is available to all our plans except for the key care plans. So what this benefit provides our member with cover for is emergency medical treatment or costing that requires treatment overseas when the member is traveling outside of South Africa. We do cover for a period of 90 days, and the cover is up to 5 million rand per person per journey. Our members also have access to an Africa evacuation benefit. So this will cover members for emergency medical evacuations from certain sub-Saharan African countries back to South Africa. Then all our plans have access to an advanced illness benefit program, and this provides members with unlimited cover for appropriate care at home, care coordination, counseling services, as well as supportive care for the appropriate end-of-life care. So this is for members that are needing the palliative care or those end-of-life care. This benefit will have to be applied for, and the members will also be able to receive GP consultations to facilitate with the palliative care. We did speak to the international second opinion services and how that is going to be enhanced for next year. The next thing that I'd speak to is the claims related to a traumatic event, and this is through the trauma recovery extender benefit, where members will be able to receive out of hospital cover under this benefit for any claims relating to a traumatic event. The benefit will have to be applied for, so should you need to use this benefit, there is an application process that needs to be followed. And what it gives your members access to is cover for 6 counseling sessions per person per year. And that's either through a psychologist, clinical social worker, or a registered counselor. And then lastly, on our comprehensive and executive plans, these two plans or these two benefits are only available on the comprehensive and executive plan. The first one is our specialized medicine and technology treatment benefit, where members will have access to cover for a defined list of treatments through the specialized medicine and technology benefit. We cover up to 2,000 Rand per person per year, and a 20% co-payment applies. Then you have the overseas treatment benefit, which this provides our members with access to, should they require treatment that's not yet available in South Africa, but can be done overseas, members will be able to have the procedure done overseas. How it works is that we have a 500,000 limit available per person. There is a 20% co-payment that does apply. And how the benefit works is that the member will have to fund for the procedure whilst overseas. And when they return to South Africa, they will then be able to claim it back from us. Lastly, under the Discovery Health Medical Scheme process, I just want to touch on the functionalities under our member app. And the reason why we have enhanced these functionalities is because we want to be able to provide our members to be able to manage their healthcare anywhere and anytime. So to name a few of the functions that you will or do have access to under your member app is you will be able to easily find doctors and hospitals near you by using our medical and provider tool on the app. It is abbreviated as MAPS. You'll also be able to connect with your doctors from the comfort of your own home through our connected care platform by having virtual consultations. You can use the medicine tracker for getting your medication delivered directly to you. You'll also be able to submit and track your claims. There's also educational content available for you on our member app for you to educate yourself on certain conditions. You can track your health if you are registered on any of our care programs and see how you are achieving your goals and making sure you are able to maintain your level of risk. And two nice features on our member app is, one, you will be able to download a digital membership card, so you no longer have to carry your physical card around with you. And the other feature is that we have an emergency assist tool available on our app, where by pressing that button, you will be able to get emergency assistance wherever you need it the most from emergency personnel. I'm going to go through the vitality benefits before I end off our presentation this morning. So just to highlight, or for those of you who aren't aware of what vitality is a incentivized program to maintain and improve healthy living, or allow our members to be healthy. And by maintaining that healthy lifestyle, we want to reward our members with certain products as well as goodies that they can receive through the partners that we have. Now, over the years, we have been having a promotional offer that was being offered by Vitality, where it is allowing our Discovery Health Medical Scheme members to access Vitality free for the first 3 months. So this promotional offer is still going to be extended to our members, and the reason for that is we've seen a lot more people taking up Vitality based on this, because in that 3 months, without them having to pay a premium, they're able to actually see what Vitality is all about and get fully engaged, and also receive quite a number of rewards in this. So together with this free Vitality, remember, Vitality and our Discovery Bank platform is integrating and have integrated their benefits. So as you will see on the next slide, is that by downloading our Discovery Bank zero fee or zero monthly fee account, you will be able to unlock quite a number of benefits through our Vitality 3-month offer or 3-month free offer, where you will have access to healthy pay, where you will be able to instantly settle out of hospital expenditure with our participating GPs, pharmacies, or other healthcare professionals. You will also be able to access Vitality Pay as you gym, where it will give you access to over 170 Virgin Active and Planet Fitness gyms nationwide for as little as 75 Rand per visit. Members will also be able to unlock Vitality Travel, where they will receive a 10% discount under your local and international flights, accommodation, as well as car hire. And the point of this is we want to establish a fully integrated functionality for our members, where you will be able to view, track, as well as stay up to date on all our platforms using just one member app that's available to you. Just to highlight and emphasize, this comes at no additional cost to you as a Discovery Health member. To give you an understanding and summary of the Vitality journey, so Vitality is all about knowing your health. So once you know your health status, you want to either maintain that health status or improve that health status. And by doing this, you will be able to partake in the various activities that are set under Vitality. You'll also be able to set personalized health goals. And once you've achieved those goals and closed all your fitness goals, you will be able to get rewarded with the various partners that we have established over the number of years. Members will receive quite a number of discounts. I mean, you can get half price on movies, you get certain percentage off on your car hire. So there's quite a number of benefits and incentives that the member can receive by partaking in the Vitality journey. That does bring me to the end of our presentation for the Discovery Health Medical Scheme as well as Vitality. Thank you so much for your time. I'll hand over back to Mohammed.
Thank you so much, Khairunisa. Really appreciate it. And people, like I said, if there are any questions with regards to what Khairunisa just presented, please feel free to pop them in the chat box. We have, I see, still about 15 minutes left, so I'm going to take you through the Sasfin Gap Plus product, which is a gap product which is administered by Ambledown. It's one of the top gap cover providers in the country. The gap cover basically assists you with any costs that occur in hospital, whereby a specialist charges you more than the agreed medical scheme rate. What the gap cover will then do is we will then cover you up to 6 times of the agreed medical scheme rate. So like Khairunisa used that example, whereby if a specialist charges you 2,000 Rand for a specific procedure while you were in hospital, but you're on a plan that only covers you at 1,000 Rand, that means the specialist is charging 2 times of the agreed medical scheme rate. Your gap cover would then obviously provide cover for that specific claim. Very important to note is that the gap cover will pay you after the medical aid has obviously processed or submitted that claim to the medical scheme where it has been processed, and it shows that there is a shortfall on the specialist. The gap cover not only covers you for in-hospital procedures that occur whereby there's a shortfall, but it also provides cover for co-payments and deductibles. And as you've seen in the presentation, let's use a endoscopic procedure or an MRI or CT scan. Those are what you call basically co-payments and deductibles. The gap cover will then also cover you for those type of co-payments as well as deductibles, depending on the plan type that you're on, that you can also claim for from the gap cover benefits. There are certain sublimits that the medical scheme has. For example, if you have a knee replacement, the knee replacement benefit or the joint itself will have a certain limit. So for argument's sake, if that limit is 30,000 Rand, the gap cover also has a specific benefit with additional benefits for those type of procedures. Then very important is for oncology and cancer. If you do reach your scheme limits, in terms of obviously the benefit that you're on, the gap cover would also provide cover for certain shortfalls that occur related to your oncology treatment, as well as any dental reconstruction that's related to a oncology or a trauma event. So for argument's sake, let's use a car accident whereby the member breaks their jaw, and now obviously the scheme has a set limit for dentistry for in-hospital. The gap cover will then also provide an additional 33,000 Rand per annum on top of that. Another nice benefit, which is also applicable on the Ambledown Gap Plus product, is the hospital casualty unit. So what this basically means is, let's say my 2-year-old is riding his motorbike and he falls and he breaks his arm. I then rush him to hospital. And when I rush him to hospital, they treat him in casualty, they put a cast on and they say, listen, he doesn't need to be admitted. I then obviously get a bill from the casualty department. Now, very important is, even though I received the bill from the casualty department, that is not an in-hospital procedure. So if that bill was, let's say, 5,000 Rand for the specialist, the doctor, and so on, then what I can do is I can claim that back from my gap cover benefit up to an annual amount of 10,000 Rand for any medical emergencies whereby the member or the dependent on the gap policy is admitted to a casualty unit. So that's a nice add-on benefit that is applicable on the Gap Plus benefit. Then these are the benefit limits that obviously are additional on top of this annual limit. So the annual limit for all of these benefits are 185,000 Rand and 837 Rand. And then the benefits that would be paid for on top of that 185,837 Rand limit would be a premature lump sum benefit. So if baby is born 16 weeks prior to obviously the initial due date, there is a cash lump sum benefit of 11,000 Rand that you can claim for from the gap cover benefit for any medical or any other expenses that obviously mom and baby would incur. Then on certain cancers, and obviously dependent on the type of cancer and the stage of the cancer, there is a once-off 50,000 Rand cash lump sum benefit on first-time diagnosis of a cancer, and this is a once-off benefit on the gap policy. So for argument's sake, if I am diagnosed with cancer, it's myself, my wife, and my 2 kids on my policy, and I claim that 50,000, my 50,000 Rand benefit on the gap policy, I would not be able to claim that. So it's a once-off lifetime benefit per insured. And then also in the event of, let's say, me passing away, I would then have 6 months worth of additional medical aid premiums as well as gap cover premiums that would be covered for from the gap cover benefit. So this is a nice benefit. So all my medical aid premiums and gap cover premiums for 6 months on the result or as a result of me passing away due to an accident would obviously be covered for my dependents or my surviving dependents for 6 months. Then there's also a ER24 virtual support service unit whereby they assist you with medical advice and support. There's an emergency button, just like how you have on the Discovery app. And then also there's a mental health screening test as well as certain lifestyle screening assessment tests. Those lifestyle screening assessment tests basically tell you what your BMI needs to be, where your kids need to be in terms of a development growth perspective. And then also a nice online-based tutoring education system for the GAP product, which gives you access to certain emotional learning for kids that are struggling, so it's like an online tutoring basis, as well as to some of the online CAPS syllabus, whereby you have access to that Cambridge International Curriculum and career guidance. So that's a nice add-on benefit to have on top of all your health benefits that you also have that would assist the family. People, what is the way forward in terms of, obviously, if you are wanting to make a plan change? Very important that you know, I think I cannot emphasize that Kerenisa did an excellent job in explaining the hospital benefits, how your hospital fees work. Is it 100%, 200%, or 300% of cover? Are there co-payments applicable? Another concerning factor that none of us like to think about, and God willing, none of us do get it, is your cancer benefit. People, we all know, unfortunately, it's a reality we are seeing within our families, within our close circle of friends and colleagues, where people are being diagnosed of cancer. You need to know what your cancer benefits are and what type of cover you have on the cancer benefit. Very important there is that the cancer benefit runs over a 12-month yearly cycle. What that means is if I'm diagnosed on the 1st of April with cancer, my benefit will run from 1 April 2022 till 31 March 2023. Very important, I must know what my limits are, and obviously, do I have a gap policy to ensure that if I do reach my limits, I can then still use my benefit. And then the chronic benefit, please make sure you and your dependents are registered for this benefit. If you are not registered, you are going to be paying for that medication as well as day-to-day consults, as well as blood tests and certain additional tests from your medical savings or from your own pocket if you are not registered for the chronic benefit. So very important that you do register, and also make sure that you send your 6 monthly or 12-month script to the Discovery Health Medical Scheme as well as to the pharmacist to ensure that they have all the latest up-to-date medication on your profile. In terms of making a decision for 2023, you need to see how much your family spends each year. Is my day-to-day benefits that I'm currently using, is that sufficient for me? Am I prepared to make use of networks? So if my medical aid premiums are too expensive, I can then say, you know what, I need to maybe go on to a cheaper plan where I can save up to 20% of my monthly premiums if I make use of a network option. So in terms of obviously reducing premiums, that is a very nice way of obviously cutting costs by making sure that obviously I use a network option, but the network hospitals that I'm prepared to use are on that list. And then obviously, am I expecting any expensive treatment like specialized dentistry or specific procedure that's day-to-day related, whereby it would warrant me a reason for obviously upgrading for the 1 Jan 2023. And then the gap cover, I've been in the medical aid industry for about 16 years now. I cannot emphasize the importance of the gap product. It has become more and more important every year. And the reason I say that is that providers are charging more than the agreed medical scheme rates. So in terms of that, the gap cover then really assists, obviously, in assisting and covering those shortfalls, as well as co-payments and deductibles. I'll give you an example. 2 years ago, my little one was born, and we obviously used a hospital that was a non-network hospital, as well as specialists that were charging more than the agreed medical scheme rate. The total bill there after medical scheme paid all my accounts was 43,000 Rand. If I did not have my gap cover policy, I would have had to pay that 43,000 Rand worth of bills, additional bills and specialist costs. But because I had the gap cover, I submitted the claim. 2 weeks later, I got paid, and I paid the providers that 42,000 or 43,000 shortfall that incurred on the birth of my son and for the giving labor of my wife, obviously in hospital, where the specialist charged more than the agreed medical scheme. So it is extremely important. And then if I'm going to be staying on the same option for 2023, there is no action required from my side. However, if I am going to be actioning a plan change or considering changing my plan, I then need to submit that plan change before the 30th of November if I am upgrading for the 1st of Jan 2023. People, please also remember that Discovery, because they are deferring their premiums, they will allow you and give you an opportunity in March to also upgrade your plan again for effective 1 April 2023. I promise you that I'm going to give you the contact details for our member service unit or our client support team, which is 011-809-7714, or alternatively, you can email them at healthcare@sasfin.com. Just an FYI on that, it is year-end where we do get an influx of queries, so very important that there is a 24-hour to 48-hour delay in getting back to you, but we will get back to you within that 24 to 48 hours of you sending that email. People, I see the chat box is very quiet. Are there any questions? I see we still have 5 minutes left, so I'm going to open the floor for any questions. Please, if you do have any questions, please put that in the chat box so that we can answer. What we have Keronisa and myself as well, that is basically going to assist you. So I see there are no questions. There was just a comment of the sound quality. So we will email Miranda if you do need a copy of the presentation or any of the information that was submitted or spoken about in this presentation and presented. You're most welcome to contact your Sasfin Healthcare consultant and they would definitely get back to you with regards to sending you that information that was presented. Okay, so I see here's quite a few questions coming through. So first question is from Leslie. Our doctors is on the network, but they are charging us for consultations and telling us to claim from Discovery. Okay, Renisa, do you want to take that one?
Sure. Thank you, Mohammed. Leslie, with that one, it would be nice for you to just reach out to Sasfin and let us know who this doctor is. Reason being, we'll need to see which a payment arrangement the doctor is on. So certain payment arrangements do allow for the doctors to, receive that claim or cash claim, and then you claim back as the member. But certain payment arrangements don't allow that. So we just need to establish what payment arrangement that doctor is on, and then we can assist you further on saying whether it is correct or whether what the doctor is doing is incorrect.
Correct. And also I see Leslie has made mention that he's saying that that was part of his, while they're in the self-payment gap, but like Renisa is saying that if that doctor is part of the payment arrangement, we then do need to take it up, obviously, with that provider. I hope that answers your question. If not, please feel free to comment in the chat box. Then the next question I think would be for myself. What is the cost of gap cover per month? So if you are on an employer group scheme or an employer linked to an employer, the gap cover benefit there would range from 150 Rand right up to about 480 Rand. But just to give you an idea, most of our groups have a standard gap cover rate, which ranges from about 150 Rand to about 250 Rand per month. Okay. Are there any other questions?
Thanks, Mohammed. While we're waiting, I see Leslie just added a few comments to his question. So just to add to that, Leslie, if it is whilst you are in your self-payment gap, remember a lot of our doctors have access to submitting claims online. So when they submit the claim, they'll actually receive a notification immediately to say whether that claim is going to be funded from the medical aid or not. So if they can see that you are in your self-payment gap, they will see the rejection. So that's when they will ask you to fund for it from your own pocket, and that's correct, because whilst in the self-payment gap, you should be funding for claims from your own pocket.
Okay, thank you, Renisa. And then I see another two more questions have come through. How do I get a chronic benefit from Discovery on my doctor? So if your chronic condition, Beverly, is one of those listed chronic conditions, then the doctor needs to complete a chronic illness benefit application form. However, if that doctor is contracted, and Renisa can correct me here or give extra comment, if the doctor is contracted, he would be able to do and register that chronic condition in the office on his tablet that he has, that Discovery obviously gives to the doctors. So I hope that answers your question. Alternatively, Beverly, you're most welcome to email me and I'll send you a chronic form. Moshe has asked, how long does it take for gap cover to cover? Example, if I have a claim from January, will it get paid? So, Moshe, there is a period of obviously 4 months from the date of the claim to submit that claim. However, if there is a valid reason as to why that claim was not submitted, we can send it through for review. But the standard turnaround period and turnaround time period is 4 months from the date of the procedure. Okay. And then I think, Renisa, this one is for you. Why is contraceptives not covered by Discovery? I'm on the Essential Delta Saver plan.
Sure. Thank you, Mohammed. So contraceptives will be covered from your day-to-day benefits. That means it will come out from your medical savings account should you put the claim through. We do not have a separate benefit limit or, for example, like a chronic benefit for where that will pay from. It gets funded from your day-to-day benefits. Perfect.
Thank you. People, I see, are there any more questions? I'm going to give it another 30 seconds. If not, for those of us that obviously need to leave and obviously are going into other meetings, thank you so much for attending. I wish you a lovely new year and a lovely weekend as well. And please be safe out there. I see there are no other questions from myself and Renisa. Thank you so much for attending and taking the time. And all the best. And if there are any questions or so on, please feel free to contact your Sasfin consultant, and we will gladly get in touch with you and assist you further. Thank you, everyone. Have a lovely weekend. Cheers.
Thank you, everybody. Bye.